Joint pain, something almost everyone experiences at some point in their lives. Discomfort in your shoulders or persistent pain in your back. Joint pain can have a significant impact on your daily life. It can be a temporary annoyance or a chronic issue that requires medical attention. In today's video, we'll dive deep into everything you need to know about joint pain, from its causes and symptoms to how it can be managed effectively. If you're dealing with joint pain or simply want to stay informed on how to prevent it, you're in the right place. Stay tuned and let's get started. If you've ever had joint pain, you know how it can affect your daily life. What exactly is joint pain? Joint pain, also known as arthralgia, refers to discomfort or pain that occurs in the areas where two or more bones meet, the joints. These include areas such as the knees, elbows, shoulders, hips, wrists, and even the spine. The joints are essential for allowing movement and flexibility, and when something goes wrong, it can significantly disrupt your ability to move freely. Joint pain can be mild, such as a dull ache, or more severe, causing sharp, debilitating pain. It might come and go, or it could be a persistent issue that worsens over time. Joint pain can affect anyone, regardless of age, but it tends to become more common as people age, as wear and tear on the joints accumulate. Joint pain is something we all experience differently. It could be something you feel when you get up in the morning, or it could be more intense. Let's explore why it happens. Common causes of joint pain. There are several different reasons why someone might experience joint pain. The most common cause is osteoarthritis, a degenerative condition where the cartilage that cushions the joints wears down over time, causing bones to rub against each other. Rheumatoid arthritis, an autoimmune condition, is another major cause, where the body's immune system mistakenly attacks the joints, leading to inflammation and pain. Joint pain can also result from an injury such as a sprain, fracture, or dislocation. Other potential causes include gout, which results from the buildup of uric acid crystals in the joints, and bursitis, which is inflammation of the fluid-filled sacs that cushion the joints. Infections, poor posture, or even overuse of a joint during physical activities can also trigger joint pain. So, there's no one-size-fits-all answer to what causes joint pain. It could be a variety of things. Let's dive into the most common types. Osteoarthritis, the most common cause of joint pain. Osteoarthritis is the most prevalent form of arthritis and one of the leading causes of joint pain, especially as people age. OA occurs when the cartilage, which acts as a cushion between the bones, gradually breaks down. Without the cartilage, bones begin to rub against each other, causing pain, swelling, and stiffness in the affected joint. The knees, hips, and hands are most commonly affected by OA, but it can impact any joint. Symptoms typically develop slowly over time and worsen with activity. OA is more common in people over the age of 50, but it can also affect younger people, particularly if they've had previous joint injuries or are overweight. Although there's no cure for OA, there are treatments available to help manage the symptoms, such as pain relief medications, physical therapy, and in some cases, surgery. Osteoarthritis can sneak up on you, but don't worry. There are plenty of ways to manage and ease the symptoms. Let's look at other causes. Rheumatoid arthritis, an autoimmune condition. Rheumatoid arthritis is an autoimmune disorder where the body's immune system mistakenly attacks the joints, leading to inflammation. RA typically affects joints on both sides of the body equally, such as the wrists, knees, and fingers. Unlike osteoarthritis, which develops slowly over time, RA can come on suddenly and cause severe pain, swelling, and stiffness. Over time, RA can lead to joint damage and deformity if not treated properly. The exact cause of RA is unknown, but it's believed that genetics and environmental factors, such as infections, might play a role. RA can affect people of all ages, but it most commonly occurs in people between the ages of 30 and 60. Treatment options for RA include disease-modifying anti-rheumatic drugs, biologics, and other medications to control inflammation and prevent joint damage. Gout, the painful buildup of uric acid. Gout is another form of arthritis that causes intense pain in the joints, often affecting the big toe, but it can also affect other joints such as the knees, elbows, and wrists. It happens when uric acid, a waste product that's typically filtered out through the kidneys, builds up in the blood and forms sharp crystals that deposit in the joints. This causes sudden and severe inflammation, often referred to as a gout attack. Gout attacks tend to occur suddenly, often at night, and can last for several days. Risk factors for gout include obesity, alcohol consumption, a diet rich in pure and heavy foods like red meat and seafood, and certain medical conditions such as kidney disease. Gout is treatable with medications, dietary changes, and lifestyle adjustments to help prevent future attacks. Gout is often called the disease of kings because it's associated with rich foods and alcohol. Let's take a closer look at the treatments. Bursitis, joint pain caused by inflammation of fluid-filled sacs. Bursitis occurs when the bursae, small fluid-filled sacs that cushion the joints, become inflamed. These sacs help reduce friction and allow for smooth movement of the joints. However, repetitive motions, overuse of a joint, or direct trauma can cause the bursa to become irritated and inflamed, leading to pain and swelling. Common areas affected by bursitis include the shoulders, elbows, and hips. People who perform repetitive movements, such as athletes or those with manual labor jobs, are more prone to developing bursitis. Treatment for bursitis typically involves rest, ice, anti-inflammatory medications, and physical therapy. In severe cases, a healthcare provider may drain the fluid from the affected bursa or inject corticosteroids to reduce inflammation. Repetitive movements at work or in sports can put a strain on your joints. Keep an eye on those movements to prevent bursitis. How injuries lead to joint pain. Joint pain can often arise after an injury, such as a sprain, strain, fracture, or dislocation. Injuries to the joints can cause damage to the cartilage, ligaments, or other structures within the joint, leading to pain and swelling. Sports-related injuries are a common cause of joint pain, but accidents, falls, or even everyday activities like heavy lifting can also cause damage. Joint injuries can lead to both short-term and long-term pain. For example, a dislocated shoulder may heal in a few weeks, but it can result in chronic pain or instability in the joint over time. Proper rehabilitation, including physical therapy and sometimes surgery, is important for recovering from joint injuries and minimizing the risk of chronic pain. A minor injury today could lead to pain tomorrow, so take care of your joints and get the right treatment after an injury. How to manage and prevent joint pain. Managing and preventing joint pain involves a combination of lifestyle changes, proper medical care, and physical activity. First and foremost, maintaining a healthy weight is crucial, as excess weight puts added stress on your joints, particularly those in the lower body like the knees and hips. Regular exercise is also important for joint health, as it strengthens the muscles around the joints, providing better support and reducing the risk of injury. Low-impact exercises like swimming, cycling, and walking are great options. Stretching and strengthening exercises can improve flexibility and reduce stiffness in the joints. Additionally, using proper posture and body mechanics when lifting or performing daily activities can help reduce strain on your joints. Taking care of your joints starts with small daily habits. Don't wait for the pain to creep in. Start with a good routine today. When to see a doctor. If your joint pain is persistent, severe, or interfering with your daily activities, it's time to see a doctor. Joint pain that doesn't improve with rest, or that gets worse over time, could indicate an underlying condition such as arthritis, gout, or an injury that requires professional treatment. Additionally, if you experience swelling, redness, or warmth around a joint, or if the joint appears deformed, seeking medical attention is important to prevent further damage. A doctor can help diagnose the cause of the pain and recommend appropriate treatments, which may include medications, physical therapy, or in some cases, surgery. Don't wait too long to seek help if you're dealing with joint pain. Early intervention can make a world of difference. Joint pain is a common issue that can affect anyone, whether it's caused by aging, injury, or an underlying condition. While it can be challenging to live with, the good news is that there are many ways to manage and treat it. By understanding the causes of joint pain, incorporating healthy habits, and seeking appropriate medical treatment, you can reduce the impact of joint pain on your daily life. If you're dealing with joint discomfort, don't hesitate to take action and get the care you need. If you found this video helpful, don't forget to like, subscribe, and share it with anyone you know who might benefit from learning more about joint pain. Stay active, stay healthy, and take care of those joints.